Techniques for Successful Local Anesthesia was developed in conjunction with the authors of the textbook Local Anesthesia for Dental Professionals as a companion to the text and is calibrated to the recommendations and guidelines specified throughout. Techniques for Successful Local Anesthesia also breaks new ground as a well-designed, standalone review for clinicians of local anesthesia. This DVD provides clear, easy-to-follow visual learning components divided into several units. The first unit discusses basic injection techniques that should be utilized when administering any type of local anesthesia injection.
If aspiration is positive, assess the amount of blood that has entered the cartridge. If there is just a small trickle, re-aspirate, and if negative the second time, continue with depositing. Remember that the anesthetic cannot be deposited any faster than 1 minute per carpule. Here is an example of an appropriate deposition rate. Finally, withdraw the needle slowly from the tissue and make the needle safe using an accepted recapping technique. A variety of commercial needle guards are available for healthcare professionals.
It is further divided into maxillary and palatal injections, Unit 2.
The posterior superior alveolar, or PSA, is a nerve block injection that anesthetizes the pulpal and osseous tissues, periodontal ligaments, buccal gingiva, and adjacent vestibular mucosa of the first, second, and third maxillary molars. The pathway of the needle is at a 45-degree angle to the occlusal plane and a 45-degree angle to the mid-sagittal plane of the maxillary molars.
Mandibular injections, Unit 3.
The inferior alveolar and lingual injections. Gently retract the cheek laterally. Palpate landmarks. Locate and palpate the internal and external oblique ridges, coronoid notch, and pterygomandibular raphe. Dry the tissue with a 2x2 prior to placing the topical.
Unit 5, Supplemental Videos, are additional video clips provided by the authors of Local Anesthesia for Dental Professionals. A resource unit, Unit 6, contains a presentation on injection techniques for pediatric patients and 2 summary charts to print and use as a reference in the operatory if desired. Every injection demonstrated follows a step-by-step approach to injection techniques. Each area of an injection is described, starting with the nerves, tissue, and teeth affected by specific injections, and ending with a discussion reviewing possible complications and comments. Local anesthesia can be a challenging aspect of dentistry. This DVD is an excellent resource when learning or reviewing local anesthesia techniques. It provides clear and concise instructions and information for the comfortable and safe delivery of dental local anesthesia.